Hello, I'm Morton Jensen, a student at Aarhus University, and at the moment I'm doing a research here at Aarhus University Hospital at the Department of Gastroenterology and Hepatology. Our study aim was finding the 20-year risk based on ALT measurement, alanine-aminotransferase at baseline for liver disease, cancer, ischemic heart disease, diabetes and death. We took a cohort from a Danish town, a random sample of 30 to 49-year-olds, healthy. We excluded anyone with an existing disease, previous events. We then took their baseline ALT measurements and divided them into groups of having a low, meaning below the normal reference, or high, above the high reference, and then we took the normal reference interval and divided that into two based on half of the upper limit. Based on these groups, we saw that persons with a low ALT measurement, which is this group, had a high risk of cancer. We saw that persons with a high ALT measurement at baseline had a high risk of pretty much any event. And then as well we saw that persons with a medium-high ALT measurement at baseline, meaning a high value within the normal reference interval, had a high risk of diabetes compared with the lower intervals, which is interesting as well. And we saw that persons with a low or a high ALT measurement at baseline had a 20-year mortality risk way above those with a low or a medium low or medium high measurement. So in conclusion, we can say that persons with an extreme ALT measurement, meaning low or high, had a higher 20-year risk of both cancer and death from any kind of circumstances, and that persons with a high ALT measurement at baseline had the highest or had a high risk of all of the endpoint events, although ischemic heart disease was pretty much the same within all of the categories. And that even within the normal reference interval, if you have a high ALT measurement, you have a higher risk of diabetes than within the normal reference interval being in the lower end. So we cannot say anything about causality because we didn't have the power to do a stratification of the lower or higher intervals, but we can say that for any reason, if you have a low or a high ALT measurement, then your 20 years risk of death or cancer, or for the high as well, liver disease and diabetes, is higher. So we should provide them with some kind of follow-up. Thank you.